My name is Urs Fischer. I'm professor for acute neurology and stroke at the University Hospital in Bern. And I'm here at the virtual Esowso Stroke Conference. And I have a special guest today, Rob van der Graaf. He's a PhD candidate at Erasmus Medical Center in Rotterdam, Netherlands. He is the coordinating investigator of the Mr. Clean Med trial, which will be presented at this conference. Thanks for coming and congratulations for the presentation of the Mr. Clean Med interim results. So could you please give me a brief summary of the background and the rationale of the trial?
Yes, of course. So first of all, the Mr. Clean Med trial is a multi-center randomized controlled trial executed in the Netherlands, in which we aim to evaluate the effect of periprocedural administration of acetylsalicylic acid and unfractionated heparin during endovascular treatment for acute ischemic stroke. What we know from previous studies is that even when successful reperfusion is achieved early after stroke onset, so about 2 to 3 hours, still a large proportion of patients do not recover and remain functional dependent. And based on the in vitro and in vivo studies, these poor outcomes, despite early reperfusion by endovascular treatment, may to some extent be explained by dysfunction at the microvascular level, also described as the no reflow phenomenon or incomplete microvascular reperfusion. And also based on literature, we know that acetylsalicylic acid and unfractionated heparin are able to modify these processes and could potentially improve the outcomes. So in the Mr. Clean Med, we apply a 2x3 factorial design, which results in randomization of patients over 6 arms, 3 with and 3 without acetylsalicylic acid, combined with or without unfractionated, so low dose unfractionated heparin or moderate dose unfractionated heparin. And we are aimed to evaluate the primary outcome, which is the score on a modified ranking scale, and the secondary outcomes are the most important: symptomatic intracranial hemorrhage and mortality.
I am very keen to note the results now of this interim analysis. Could you please summarize the major findings of the interim analysis?
Yes, glad to. So, the first results of this Mr. Clean Med trials consider the interim results as the Data Safety Monitoring Board advised on April 2019 to stop enrollment in the moderate dose unfractionated heparin arm of the trial for the concerns of safety. And this decision was based on our regular safety assessments after every 5 symptomatic intracranial hemorrhages and or 10 deaths, which we report to the DSMB. And they, moreover, advised us to continue the other arms of the trial. And what we found was, what we observed was that in the moderate dose unfractionated heparin arm, compared to the aggregated data of the other non-moderate dose unfractionated heparin arms, as we are still masked to these arms, considering control acetylsalicylic acid and low dose unfractionated heparin, that we observed that there was almost a 6 times increased risk of symptomatic intracranial hemorrhage risk in this moderate dose unfractionated heparin arm, which was accompanied by also increase in mortality risk in this arm.
These are relevant findings also for a lot of interventionalists that apparently heparin in the acute phase of the endovascular intervention is not beneficial at this dose. May I kindly ask you whether these patients received bridging thrombolysis before, or whether these patients were treated with direct mechanical thrombectomy or both? And if yes, was there a difference in between the 2 arms?
Yeah, we're still, so answering your first question is that we included patients that both received IV alteplase before or not when there was a contraindication as a bridging therapy before endovascular treatment. And we have a small number of patients included, so we will look into that, into this issue further, but that will follow. Yeah.
So what are the next steps? As you mentioned, the trial is still ongoing. Can you please explain what is the next step of the trial?
Yeah, so our first conclusion would be that in the Mr. Clean Med periprocedural treatment with moderate dose unfractionated heparin, consisting of a loading dose of 5,000 units intravenously, followed by continuous infusions of 1,215 units per hour for 6 hours, is associated with an increased symptomatic intracranial risk and mortality risk and should be avoided. And one hopeful conclusion we can draw from these interim results is that the absolute bleeding risk for the other arms, so considering control, low dose and fractionated heparin arm, and acetylsalicylic acid of 5%, seems reasonable and provides definite confidence to continue these arms of the trial. So these results will follow in the near future.
So your findings somehow also confirm previous observation that heparin in the acute phase of a stroke in most situations is not beneficial. Do you agree with this conclusion? Yeah,
so I agree at a certain point that for in our study the moderate dose is not beneficial, as we still have the low dose and fractionated heparin arm in our trial, which is also a loading dose of 5,000 units, but followed with a lower continuous infusion of 500 units over 6 hours. We still are evaluating whether this might be beneficial during endovascular treatment.
And the comparator of the low dose is aspirin?
Is control, yeah, so no heparin, yeah.
Okay, so we will know after the end of the trial whether low dose heparin compared to aspirin will be beneficial.
Yeah, so we will compare the low dose with no heparin and aspirin with no aspirin.
Okay, so we are very keen to read the results of this interim analysis. Will it be published or is it already accepted for publication?
No, we are still preparing the manuscript, and we hope to submit it as soon as possible, hopefully in the coming weeks.
So we are very keen to see the results. Congratulations for your tremendous job, and also thank you very much for presenting your data at this conference. Thank you very much.
Thank you.